Yeah, so I did a video about 7 or 8 days ago about the Pemberley surgery incident and how I'd never been arrested in 32 years of my life. And now I've got a conditional caution plus £406.29 to pay back for the 30th of March 2017. Anyway, as you know, I went to the Safe Luton treatment scheme. If you've been following this, you probably haven't, doesn't matter. Over on my YouTube channel. Hold on, just give me a second. Yeah, I had to pause it there for a second because both parts were being naughty, getting entangled up with electrical wires. Benji, no. Good boy. So yeah, I did a video 7, 8 days ago, I said. I'm being referred to the Safe Luton treatment scheme. It just said to write for repeat prescriptions, nothing about having to phone them. I hate using the phone, prefer face to face. So I run out of antidepressants technically tomorrow. I'll have one, so I run out on Sunday. They said now they've posted it out, but they still need to talk to me over the phone. So hopefully me and my boyfriend will be able to do that over the phone sometime next week. It would have been nice if Pemberley Surgery in Bedford had given me like 2 or 3 months worth of electronic repeat prescriptions or paper prescriptions predated in advance, because getting to Luton not that easy, and I'm not made of money if it requires me going down there to get a prescription. I don't know. All I know is that Luton Safe Treatment Scheme seem to not do electronic prescriptions, so therefore Pharmacy to You will no longer be delivering it to my door, unfortunately, and they've deleted my account. I chased it up and said, "Oh, are you sure you can't do paper prescriptions?" They said they'd look into it, and funny enough, I got an advertisement that says, "Here's 5 doctor's surgeries. If you're a new patient or a new person in this area, why not try us?" I think that's because I said how good they were, and that I really, really needed them in Bedford a lot. Yeah, I haven't really washed or changed my clothes or anything like that. I've changed my clothes, like I wear tracksuit bottom indoors, and then I'll wear jeans when I go out, but the same jeans when I go out, and the same hoodie. I haven't washed one pain patch thing there, so that's at least a week old, followed by another pain patch thing there I haven't washed. Go away, Benji. And this is Wednesday's pain patch. I've only washed the skin. With soapy hot water, but that means I haven't had a proper bath or shower for at least 12 to 14 days. If each patch is 7 days old, that's at least 2 weeks, plus Thursday, Friday. Okay, so the last 16 days, I wish for the last 16 days I haven't had a bath or a shower. I only wash the skin with hot water, and that's like, can go up and down regularly over a year or a month cycle of not washing, bathing. So I could wash for 1 month every week, and then another month I could not wash for like between 2 to 4 weeks perhaps. And of course, the only doctor that knew me really detailed, because he knew me before my depression and all that, was so I'm just taking something off Benji that he shouldn't be eating. What you got in your mouth now? What you got in your mouth? Nothing that I can tell. Ugh. No, you do have something in your mouth. What you got? Sorry, I normally would have paused this. What are you chewing on? No, you're just chewing on munching on your teeth. Doesn't sound normal. keep an eye on him. He took something that he shouldn't have. A bit difficult to do a video when you're looking after two pups as well. But John's having a shave. Got some kind of cold or flu. Yeah, so my depression can go up and down, and that's why it's called moderate to severe, and I understand that. The only doctor I was about to say that knew me great detail was Dr. Talani in London, but that's because he knew me from 1984 to 2009, and then I had like a self-harming incident, and I was asked to move on to another surgery. And that's when I met another doctor in London called Dr. Tomlinson. He knew me as well, but only from 2009 to the 13th of the 6th, 2016. He obviously knew about my mental health, and then we saw about that. But because I would sometimes visit my boyfriend and then crash, I might be there for 3 weeks, I might be there for a couple of days. Often I was there for months, so therefore it was a lot harder to go to the GP surgery if I was having a breakdown or not cleaning or washing a baby. But then I thought, well, there's nothing the GPs can actually do. If I'm already getting the therapy and I'm attending group, I did CBT, I've done psychodynamic therapy, and I did MBT between 2013 to 2014, a 3-day group, and then I tried to reduce it, and then they did a reassessment, and then they said I never told them about my Tilex, or also known as Cocodamol. I was like, I did, but I didn't mentally have the energy to challenge the investigation and the ban. And now they don't own, they run Bedford and Luton, where I've tried to get some therapy. Now I'm in a new place, new area, no one. And I don't know if I'm still technically banned or unbanned, so I'm going to get a charity to help me. Recommended of my MP, Conservative, funnily enough, helped me, Mr. Richard Fuller, for Bedford and Kempston. He referred me in a letter saying that there's a charity, I think it's pronounced, I don't know, I don't know how it's pronounced, I think it's Pohwer, Pohwer, and they help with complaints procedures within NHS and mental health services, and as an intermediary. So I may ask them if I'm still technically banned or whether we need to open up the ban or investigation again. But I've had no actual one-to-one for the last just under 2 years, because it happened sometime in 2014, this ban, and then was reinforced by a complaints procedure. So I've had no therapy for just under 2 years, and that's when I learned my borderline personality disorder diagnosis, or emotionally unstable personality disorder, kind of dumped on me in 2013, where they went, would you like some more therapy after the psychodynamic? I said, yes please. They said, oh, we're sending you to MBT, and then we'll send you to an introduction 12-week course. I was like, cool. But then they gave me some paperwork about MBT, and every medical reference at the bottom of it was BPD. I was like, what the hell is that? I googled it. Then I found out everyone in the group in July 2013 had BPD, and it kind of been dumped on them, because mentalised based therapy, MBT, is meant to be the best therapy for borderline personality disorder patients. And then I've found out over the years that the nicest guidelines are that you should have 1 year's CBT. TIC had either 2 to 5 years psychodynamic therapy. Well, TIC, I've had 2 years psychodynamic therapy. And then 18 months of a 1-day course or a 3-day course of MBT. I've only had less than 6 months TIC. And then after those 1-day MBT 18-month course or 3-day course, you're then meant to have another 18 months of an hour and a half with a massive group. So you might only get 5 minutes, you might get no minutes. It's more of a check-in. Are you using the therapy correctly? Has it helped you? Blah, blah, blah. So I don't think it's presumptuous to ask for some MBT in Bedford or Luton and get the full 18 months worth. But at the time, I had no idea that Bedford was owned by East London Foundation Trust, which I do now. So there might be technically a ban in place unless it's reopened, and I challenge it through the charity, POHWBR, I think. Be a complicated process because they were going back years as well as just under 2 years. Also, that my pain specialist said I should have one-to-one therapy, and that he had disagreed with the assessment that the psychiatrist had made at the time. And then another meeting he said, oh, you just have to let sleeping dogs lie, or sorry, he said, actually you'll have to let sleeping puppies lie and just rely on charity. That's what I did. I did a 3 out of a 5-week course of mindfulness with City and Hackney Mind late last year, 2015, and I think I did 1 or 2 evening courses of it, which was like a refresher course. I never got my certificate because I couldn't go to the Christmas party last year, so I did that. Shush Benji, I'm trying to make a video, and hopefully I'm not banned because it's a new area, a new constituency. Technically just only been taken over by a new trust, and although now Pemberley Surgery might cancel that initial assessment that I'm having in November because it's down to the Luton treatment scheme to decide whether they want to fund counselling, and obviously Pemberley Surgery had already given it the go-ahead earlier this year, but the first appointment wasn't until the 4th of November for this year, so that may add extra complications. Yeah, basically this salary GP said borderline personality disorder isn't that serious, and so I don't know if it is or isn't. Yeah, I had to pause that because obviously John doesn't want to be on camera, that's fair enough. Yeah, so this GP said, oh, borderline personality disorder isn't that serious. Now, it feels serious to me, but I've got nothing to compare it to because I'm still learning about it because it was kind of just dumped on me. Whereas I know bipolar disorder is very serious. I've never claimed to have that either. I have moderate to severe clinical depression for the last 13, 14 years, but she said, no, you don't have that, you don't have any mental health problems, you don't have anything as serious as bipolar disorder. And I was like, I never said I had that. She said, you've got nothing serious like moderate to severe clinical depression. And I was like, I do, this is why I lost my temper, but it took a long time to lose it. And then she said, oh, you don't have anything like suicidal thoughts or past attempts. And I'm like, I do. But looking back at some letters, it says the word significant depression and anxiety, and it'll be complicated, but it doesn't say moderate to severe. And they also use the word self-harm, where self-harm could require no stitches, but for me it required 12 to 13 stitches in 2010, for example. I don't class that as self-harm, that was a suicide attempt. But I can't make them write suicide attempt or suicidal in their notes, just as I can't make them write moderate to severe clinical depression. Just as like they dumped borderline personality disorder on me and never told me it until like 2013, and then I kind of had to ask, and then I said it fits me a bit, but I still don't know much about it. I don't know if borderline personality disorder is as serious as bipolar disorder or as serious as moderate to severe clinical depression, or severe anxiety or severe panic attacks. But I think it is serious, but she said it wasn't. So, and then she said a lot of things that I didn't have, which I did. But I can see by looking at past letters from psychiatrists, it could look confusing, because the only words they use is significant depression and anxiety with complex interpersonal interaction, blah blah blah, but they don't use moderate to severe clinical depression words or terms. Anyway, dogs are being noisy. I've got to stop this now, and hopefully it'll upload on YouTube quite well with some sound.